Here's a run-through of the HINE examination so you can see the important items as they are completed with a child. Cranial nerves. You can examine cranial nerve function by observing the child's spontaneous activity while talking to the parent before the formal examination. Watch for symmetry of facial expressions, intact sucking and swallowing, full range of eye movements, and behavioral response to light and sound. Listen for strength of voice. Tone. Scarf sign. With one hand, take the infant's hand and pull the arm across the chest while placing your other hand on the child's ipsilateral chest to steady the shoulder. Keeping the child's head in the midline, note the position of the elbow in relation to the midline. Note how far the elbow moves across the body. Does the elbow reach across midline to opposite axillary line, reach midline, or does not reach midline? Passive shoulder elevation. Lift the arm vertically and continue until the arm lies alongside the head. Repeat the shoulder elevation maneuver on each side. Note resistance. Pronation, supination of forearm. With one hand, hold the child's elbow. With your other hand, hold the child's wrist and rotate the child's forearm at the wrist, supinating and pronating it through 180 degrees. Note resistance. Hip adduction. Place the child in supine on a flat surface. Can be floor mat or parent and examiner knees. With both of the child's legs extended. Abduct them as far as possible from midline. Note the angle formed by the legs. Popliteal angle. In supine, keep the child's hips on a flat surface. Flex both thighs onto the abdomen. Then extend the knees until there is resistance. Note the angle behind each knee. Ankle dorsiflexion. In supine, keep the child's knee in extension. Dorsiflex the ankle. Note the angle between the dorsum of the foot and the shin. Pull to sit. Starting in supine, hold the child by both wrists and pull the child up into a sit. Watch for head lag as the child comes up. Protective reflexes. Arm protection. Starting in supine, hold the child by one wrist. Use your other hand to steady the child's contralateral hip. Pull the child by one wrist. Note if the child reaches free arm toward flat surface for support. Note if the child opens hand and bears weight with that free arm and hand on the surface. Vertical suspension. Hold the child around the trunk with child facing parent. Suspend vertically and note if child kicks legs with equal strength. Ask parent to briefly tickle the child's feet if needed to stimulate kicking. Lateral tilt. Hold the child around the trunk and suspend vertically. Tilt to each side by about 45 degrees towards the horizontal. Note response of trunk, spine, limbs, and head. Forward parachute. Hold the child around the trunk with child facing parent and suspend vertically. Quickly tilt forwards. Note if there is a brisk forward symmetrical arm response. This response is seldom present before 6 months post-term age. Tendon reflexes. Choose a comfortable position for child. Could be supine or could be sitting in parent's lap. Wait for muscles around the tendon of interest to be relaxed. Use a reflex hammer for best results. Biceps tendon reflex. Hold the back of the child's elbow and place your thumb over the biceps tendon. Tap thumb with gently held reflex hammer. Note contraction of biceps. Crossed adductor reflex. Place your fingers on the skin over the medial epicondyle of the femur or the medial condyle of the tibia. Tap fingers with reflex hammer. Note contraction of contralateral hip adductors, which causes leg to move in toward midline. Note if cross-adductor response is present. Knee-jerk reflex. Tap patellar tendon below kneecap with reflex hammer. Note contraction of quadriceps. Achilles tendon reflex. There are two approaches to eliciting the Achilles tendon reflex. The first approach is to passively dorsiflex the child's foot and tap the Achilles tendon above the heel. The second approach is to passively dorsiflex the child's foot. Place your thumb in the middle of the ball of the foot and tap your thumb. Note contraction of the gastrocnemius. Primitive reflexes. Plantar grasp reflex. Press your thumb against the sole of the child's foot, just below the toes. Note flexion and adduction of all toes.
Uh-oh, you dropped the boy. So she doesn't have this plantar.
Babinski reflex. Use your fingernail or pointed tip of reflex hammer handle.
She still has that one too. Yeah.
Stroke the lateral aspect of the sole of the child's foot. Note an upgoing great toe and fanning of the other toes in infants. Presence of this reflex is abnormal after 1 to 2 years of age.